Hospitals across the country and right here in Texas facing unprecedented economic challenges due to inflation.
KVUE's Darenisha Heron obtained an email from one of the largest hospital systems in the state that says it's pausing recruiting. Tonight, she explains the implications of inflation on your care.
Healthcare experts say the quality of care at Texas hospitals is on the decline as many battle inflation. John Hawkins, the CEO of Texas Hospital Association, is seeing the impacts.
In an urban area, you're going to see more delays in care. You're going to have to travel further for care. If you're in a rural area, you really do have the challenge of your hospital closing.
To stay afloat, hospital systems are having to cut things like preventative care options, including OBGYN services. Texas Children's Hospital, one of the largest systems in the country, is even feeling the inflation pains. A location just opened in Austin in February, and employees recently received this letter saying the system is, quote, facing unprecedented challenges due to the economic climate, and made the decision to momentarily pause recruiting and backfilling positions, end quote. They're also evaluating all expenses and investments. In a statement, a spokesperson for the system told us, despite the rising costs, quote, Texas Children's remains steadfast in its mission to expand access to healthcare services for those in need, end quote.
We are dealing with increased supply cost, increased pharmaceutical cost.
But Hawkins says the largest economic burden is labor amid the staffing shortage amongst almost all medical staff.
Hospitals have been forced to use contract staffing agencies,
which costs more than the regular employee. On top of that, Hawkins says insurance companies are causing an administrative burden due to their practices, like prior authorization.
Your care is delayed while you're waiting for approval for that care. It can also result in delays in care up front if you have to schedule a new procedure. And we also know it delays discharge to lower levels of care as well.
Hawkins says in the next legislative session, they plan to ask for accountability from insurance companies, as well as more behavioral health facilities, as an increase in mental health patients is also costing hospital systems. In the studio tonight, I'm Darenisha Heron, KVUE News.